Welcome to your EMS Safety Services CPR training course. Today, you will learn to recognize and to respond to the life-threatening emergencies of heart attack, stroke, choking, and cardiac arrest. In the case of cardiac arrest, there are 4 interventions that need to be performed early. Call 911, start CPR, use an AED, and begin advanced care with the arrival of the paramedics. The less time taken between each critical step, the better the odds for survival. In this course, you will learn the most important actions to take to save a life. So let's get started with a few basic things we should all know.
Even though there's already enough to worry about during CPR, I know many of you are concerned about the legal issues that may arise when attempting to save someone. There are 3 areas to discuss here. The Good Samaritan Law protects you, the citizen rescuer, from the fear of being sued when responding to an emergency. Rescuers who respond voluntarily without compensation and stay within the scope of their training are protected under this law. Next is gaining consent. Everyone has the right to refuse care, but when the victim is unresponsive, as in when you're performing CPR, consent is implied under the law. The last thing we want to mention is the victim's right to privacy. Just as doctor-patient confidentiality operates, any information you obtain about the victim's medical condition is strictly private and not to be shared with anyone, such as coworkers or bystanders. Our next short topic is bloodborne pathogens. What are bloodborne pathogens? We've all heard of HIV and hepatitis B and C. These are the most notorious examples of bloodborne pathogens, diseases which are transmitted when the blood or body fluid from an infected person enters a rescuer's body. During CPR and first aid, rescuers can be exposed to bloodborne pathogens. Fortunately, with the use of a little common sense and personal protective equipment, exposure can be greatly reduced. How do we prevent exposure? To know how to prevent it, we first need to know how it occurs. There are 2 methods of exposure: through a direct splash on a rescuer's eyes, mouth, or nose, or through a break in the rescuer's skin, such as a scab, a fresh cut, a puncture, or a rash. There are simple steps to prevent an exposure. First, assume that all body fluids are infectious. Second, use personal protective equipment whenever you think there is a risk of exposure. Personal protective equipment, or PPE, includes the use of moisture-proof gloves, protective goggles, and a CPR barrier device for rescue breathing. Unfortunately, even with proper protection, exposure can sometimes occur. If you are exposed to blood or body fluids, take the following steps. Wash any exposed area immediately with soap and water. If splashes to the nose, mouth, or eyes have occurred, flush the affected area thoroughly with water. Dispose of any contaminated clothing or objects in a leak-proof container. Report the exposure to your supervisor if you're at work, and follow up with your physician.
I'll call maintenance, Jimmy. Just leave it alone.
I got it.
John, is it too late to get this out?
Nope. You just made it.
Thank you. Jimmy.
Oh my God.
Each year, too many Good Samaritans needlessly die or are injured because they fail to stop and take a breath before they respond.
Now, let's all take a deep breath. Breath is an acronym to help you identify scene safety and treatment priorities. B, you want to be prepared. This means getting trained in CPR and first aid and getting equipped with PPE, getting barrier devices and first aid kits for your home, work, and vehicle. And of course, carrying a cell phone. R, relax. It's easy to get excited or overwhelmed in an emergency situation. So relax, take a breath, and think about your priorities. What is priority 1? environment. Assess the situation. Is the environment hazardous? Is there traffic or fire? Are there loose electrical wires or chemicals? Remember, your own safety comes first. Once you've established that it's safe and you're at the victim's side, begin with the ABCDs. The ABCDs guide a rescuer through the top treatment priorities in any emergency. We'll learn more about the ABCDs in a moment. T, treatment or triage. Estimate the number of victims and treat those who have the best chance of being saved. And finally, H, help. Call 911 or send a bystander if possible.
Joan, is it too late to get this out?
Nope, you just made it.
Thank you. Jimmy.
Oh my God.
Oh, don't touch it! Turn the power off.
Power's off.
Okay. Jimmy. Joan, call 911, get the AED and the first aid kit, and come right back.
Okay.